Welcome to my podcast. Today I'm going to talk about the case station for the entry candidate to School of Medicine, Liverpool. So the station was about patient record access, which is under the umbrella of healthcare awareness. So it says since October 2023, patients in England have been able to access their GP record through the NSH app. And obviously, each candidate, they show different answers. And some they were quite confident and excited. Some they were like impassionate and like they lacked energy. And they were like masked face, even in their answers. And they weren't even aware about the NSH app access. So the question says here, describe to benefit of the patient being able to access the GP record and justify your answer, vice versa for the two potential drawback for patient being able to access their GP record and justify your answer. So I'll try to say and brief about basically the benefits in terms of the patient and the healthcare provider and the system in general, because here it's stemmed from two functionality. So the benefit for the patient is basically patient will be able to check their record, make sure that it's accurate as it's been said, as it's been stated to the doctor, and there's and also for saving their time if they want a quick look in what has been said, or if they have upcoming appointment to know what's being written and being said. And in terms of the medication, for instance, if it was stated, how do you need to take it, and how and what forms and how frequent. And so in that regard, also it will increase the engagement and the understanding, so the patient can better understand about their health condition, the care plan, test result, which increase involvement in the decision for the healthcare and the service provided. Also, it will improve their medication management, so the patient will be more equipped, for instance, to manage their medication and follow the treatment instruction when it has the access to their record. Also, it will enhance the health literacy, whereby access to the record can help the patient stay informed about their health, updated information, empowering them to make the better decision about their life and their well-being, and also greater control and trust. This will establish, of course, trust between the patient, doctor, and the health system. So by accessing their information, this will foster greatest trust in the healthcare provider and sense of control over their personal life and personal health. And it will be informed more about their consultation. Patient can prepare for the appointment by reviewing the records and leading to more productive discussion with their clinician in saver time and efficient time. From the healthcare provider system, it will improve, of course, the patient-provider communication. So access to the record will facilitate communication and more collaborative, of course, relationship between the patient and their doctor and the healthcare provider. It will increase, of course, data accuracy. So if the patient finds something wrong or something inaccurate or misinformation, this can lead to improved data quality of the healthcare provider. However, here I'm going to provide about my personal experience when I was hit by this e-bike rider who hit me from my back in the pavement and stuff like that, which caused me obviously some problems that I struggle with till now. For instance, today, even while I'm conducting the review, I can't really breathe properly, and I feel the block in my right side. But obviously, I just need to keep my composure and finish the stuff. I was in too much pain from my neck as well, and I can't even bend it. And also, I'm lately having this impingement in my right arm. So what I'm trying to say here, I once checking my NSH record, and I found one of the GP where I didn't even met. He wrote that instead of being assaulted by e-bike, he wrote sexually assaulted, which triggered too much anxiety and distress and angry for me. So I took a snap and sent it multiple times to my GP and then to the administrator in order for them to correct and rectify and remove this nonsense. Also, multiple times I find record that I said I was hit by e-bike, and I just find them they wrote by scooter or by a car, God forbid. Obviously, even in the recording, though you say the things clearly and quite clear, I mean, mistakes still happen, but I'm not quite sure about how you're going to rectify, because multiple times I find some of the stuff just being copy-paste without following it to the entry. So it's kind of difficult sometimes. And also once GP recorded my BB as I'm having high blood pressure. So yeah, you can see that there is sometimes even the healthcare provider can make mistakes and inaccuracy, and sometimes it's quite frustrating, and you find yourself that you need either to go to them, call them, which obviously going to take time, waste resources and stuff like that. So that is one of the things that I notice. The other benefit, it's going to reduce administrative workload, automatically sharing information and access to the results, reduce the number of calls and manual processes for the GP. Say, for instance, like your blood test, you can check it through the app. Even if you did it in the hospital, it will show. Just give it some time. Also enhance safety and effectiveness. Patients can identify the potential medication error, for instance, if something has been issued by mistake, and contributing to overall patient safety and care effectiveness. I'm going to share another thing. When I was assaulted and I had the fracture of my, obviously, left hand, I requested my imaging, and I was sent an old lady thumb fracture, which is not mine, and she's in her late, she's quite old. And once I saw it, I knew this is not mine, and obviously need to download it in encrypted form. And I just took a snap and I sent it back to the hospital saying that this is not me and blah, blah, blah. But obviously, no one came back to me, and there's certain stuff you can't control anyway, so we just hope. So the other benefit of the health provider is better, of course, health outcome by fostering shared decision-making and important patient self-management and access to their record, which has the potential for the positive impact in the health outcome. So this is basically, I would say, like the positive things. So you save your time. You don't need to call the GP. You don't need to wait for the call. Just log in and have an internet and check your info. And if you needed anything that you wanted to double check. And it, of course, saves you time, as I say. But, of course, it's, as I say, needs an internet accessibility, access. If you are feeling unwell, under the weather, you wouldn't go. So it's like having the say about your info and about the data you provided. And of course, it's like you need to have your mobile or your smartphone, and the data should be there, hopefully not to be lost. However, if you're moving from one territory to another in the UK, or from one GP to another GP, I'm not sure if the data will show, because from personal experience, my previous GP doesn't show in the app, so that's a cons. And when you look through the app, there is a certain section you can look as well, which is different from the GP data. Like, for instance, I just recently knew that while I was serving to my through app, I mean, like the organ donation, you want to opt in or opt out. Also, if the patient have mobility issue and they can't walk and stuff like that, so that they can just access their mobile and look for the information and have their own say about their own thing. So for the potential drawback that would might harm the patient, say for instance, if the patient is obsessed about knowing everything, checking all the time, not knowing any of the info, or all the time checking his app or her app. So it means this one, they're going to call the doctor all the time, take too much time, and will, of course, if the patient read something that he didn't understand it, or maybe the doctor, he didn't mention that, the patient will be angry, frustrated, and wanted to know what's this and what's that, and might check in the internet, fetching certain information which can be misinformed or not correct. So this will, of course, cause too much pressure for the patient as well. The other thing, if the patient is not friendly techo, which means that they don't know how to use the technology. Like, for instance, certain people, they don't know, or they don't have a mobile. I know a friend who's quite old. He's not quite old. He's like I would say young man. I mean, in the UK, anyone 50 and over, they're gonna say young man anyway. So he doesn't use smartphone, so he wouldn't have this any such thing, and he wouldn't check. Also, the disadvantage also, if, for instance, the information has been breached or leaked or hacked or said by a third party, so that means like your information is not safe, is not encrypted, and thus this will stop the trust relationship between the doctor and the patient. The patient will be quite angry, frustrated. And if the system is down, for instance, and buffering or updating, blah, 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 this will cause, of course, frustration for accessing your data when you need it. For instance, it might cause too much confusion for the patient or whoever who want to check their information. And this will erode doctor-patient relationship. And also, if the information is quite sensitive and it's being written in the wrong way, like my condition I just mentioned, so that's another thing to be considered as well, which won't be nice at all and just give you too much thinking how this could happen. So here we're going to divide it like the risk or the potential for the patient, risk or potential for the healthcare provider, and risk for the patient record. So for instance, in terms of the patient, the misinterpretation can cause distress. The patient might find something surprisingly or shocking for them or difficult to interpret. This causes too much anxiety, distress unnecessarily in the record, which can, of course, impact them negatively in understanding their care, and just, you can understand what's going to happen. Also, in terms of the lower socioeconomic status, where there's health disparity, and some of the people who are less health literate, or maybe they don't understand, or maybe they are illiterate anyway, so they will be less able to engage with the record and potentially widening the gap in the healthcare access and understanding, or if they have issue also in reading English as well, that's another issue. This also might increase the burden, so the patient might need to ask for clarification, explanation of their notes, and this will increase their emotional and practical overload and the workload as well. So in terms of the healthcare provider, of course, impact, it will be huge and vast under documentation, so the clinician may avoid documenting sensitive information, concern for the fear of worrying the patient or leading to misinterpretation, which could affect, of course, the quality of the medical record and the future patient care, because doctor need to record factual thing, but from the other side, if the patient read that and got stressed and worried, or gonna affect them, of course. The other thing, it's increasing workload. So preparing notes for the patient to view and managing their access and addressing patient questions and concern adds the administrative clinical workload of practices. And the other thing, which is very important, liability and who's responsible. So the healthcare provider may face professional legal action for improper access or sharing of unauthorized alteration or records. And the risk for the patient record, of course, accuracy or alteration while access provider can provide an opportunity for the patient to correct the error, but there is a risk for the patient introducing unauthorized, of course, addition or deletion, which might, of course, cause issue. And this will lead to serious consequences if not properly managed, because it needs to be monitored and make sure this is the right thing. However, this is something, of course, has pros and cons. And the other thing, from the term of security and privacy, patient may have some concern about the security of their own device, storing health information. The record may remain a target for cybercrime, like many times happened, and necessitating a strong security measure to prevent unauthorized access. So this is about cyber attack and leeching medicine and those kind of things. So the third question was about, as we know, that what should the doctor or the GP consider when writing in the electronic record, given the patient know that have access to them. So the question was kind of confusing. I think the way it has been written is kind of difficult, or the stress or thinking or whatever. Though I try to simplify that if you are a patient and you would like to check your record, what the GP should put into consideration while writing or feeding the information. However, some of the candidates they did quite well and they grasped the idea and answered straight away. So it's important for the GP to write legibly and write clearly, concise, factual, in order information. The language should be in layman language, shouldn't be medical jargon or abbreviation, which can be confusing. And of course, there's a lot of abbreviation sometimes you can face, and when you Google it, you'll be surprised. There are different things that you're gonna come up with, and sometimes it's different teams and different backgrounds. So the note that the doctor should add, it should be objective, factual, and note may serve as a legal evidence as well. And you have to be aware of the certain words can be familiar to the doctors, but can be misinterpreted to the patient. Like, for instance, if patient read something like deranged or frail, this will give a different connotation, and it would cause too much stress for the patient, distress as well. And also, it's very important, one only for the candidate pointed that, and she was really very good. It's very important because I remember when I was doing the medical protection course, they shown us some of the comments which the doctor they used to write, which is not nice and very, very offensive. Like, for instance, he would write, "Oh, this obese came back to me. Oh, this boring patient. Oh, she doesn't understand," and blah, blah, blah. I remember one of the GP, he wrote something like this when I was visiting multiple times, of course, and it was different GP, so he just wrote his own comments. So it's not nice to write that, because this will cause like an insult. You don't need to put your personal comment about anyone. Just write anything that you think it's medical, and apart from that, you need to refrain and hold your horses. So it's avoiding making personal comment about any patient because this is very insulting, not nice. And you shouldn't give your opinion. You can advise or point out to something, but you shouldn't coerce or emphasize anything that shouldn't be nice. And GP should consider that the patient may access the record and see the information that's new to them and has not been even previously discussed. And this happened multiple times. When I check my record, I find certain stuff that I didn't even say it and just written, which, like, for instance, he checked something and he never done it. So that shouldn't be. This is it's like cheating. For example, when ordering an investigation, they should try to ensure the patient understands the possible next steps for each possible outcome of that investigation and what to expect and what they should do. And also, if the patient gave certain symptom and the doctor documented that, he should also document if he said any red flags to patient in order for them to either contact the GP and the working times or contact the A&E. However, life is completely different. That's what I come to know lately. Let me know what's your thought down below in the comment, and I shall come back to you in another station. Thank you.